As the numbers keep climbing, Governor Ralph Northam has declared a state of emergency in the Commonwealth.
It's only in place for 30 days, but he says it will help frontline workers provide the best care they can to their patients. Sarah Hammond tells us why hospitals say this will be a big help.
As COVID-19 cases and hospitalizations hit record levels in Virginia, Governor Ralph Northam says it's time to step in and help with a state of emergency declaration.
This isn't restrictive in any way. Instead, it relaxes some regulations.
He says this 30-day state of emergency will help hospitals add more beds, open up more tasks to physicians' assistants, and allow out-of-state medical workers to lend a hand in Virginia. It's also going to allow more people with medical experience to give COVID-19 vaccines.
Dr. Todd Parker, an emergency physician with Riverside Health System, says they are at capacity.
We've never really seen with the previous variants a surge like this of this rapidity and intensity. It's overwhelming hospitals and ERs.
But he says this order will help with that.
Without the state of emergency, the hospitals have a very strict set of guidelines that we have to follow. And this gives us some flexibility to get creative in how we're going to see and care for these patients.
According to Centera's COVID-19 dashboard on Monday, they currently have 475 people hospitalized with the virus across their Hampton Roads hospitals. Dr. Jordan Asher, executive vice president at Centera Healthcare, agrees this will help lift a number of burdens.
It will help on being able to expand to more beds. It will help on staffing issues. It'll help on clinician issues.
He says with Omicron as contagious as it is, that's what's sending so many people to their hospitals at once.
We hate to have an emergency order. No one wants an emergency order. But in the situation that we're in, when things are as busy as they are, we do appreciate that help and support.
For 13 News Now, I'm Sarah Hammond.
We reached out to Governor-elect Glenn Youngkin's team to find out if he intends to uphold this state of emergency once he takes office in just a few days. His team told us, quote, Governor-elect Youngkin supports the use of tailored executive action that removes staffing barriers and provides healthcare providers the flexibility in order to deliver high-quality care and give overworked medical professionals the relief they need.